So nice, we could watch it twice. Welcome, everyone. Thank you so much for being here today at the Fall 2025 Center to Advance Interprofessional Education and Practice Interprofessional Student Showcase, where we're going to be celebrating the work of 18 different teams today with 47 student participants in 13 programs and 18 active faculty and other mentors making it happen, although, of course, we're supported by many other folks throughout the year that make it all possible. So my name is Chris Hall. I am the director of the center, and I'm joined here by Michelle Cody, who is the program coordinator and the developer of that fantastic video we just watched. I'd like to give a shout out to Lee Cody and Dave DeDiego, who are working in backstage to make sure that this all runs smoothly, and of course to our track proctors and facilitators who you will see in the breakout rooms who will help everything run smoothly as well. I'm going to turn it back over so that you can hear from the Interprofessional Student Group has prepared a little video for us, and they have a lot going on in the spring. It's been a wonderful time having the College of Medicine here and being able to bring students together in more social ways than we in CAIEP have generally been able to do. And so they're going to talk a little bit about that, and I'll play their video now.
Welcome to the Interprofessional Student Showcase. We are IPSG, the Interprofessional Student Group, and I am Morgan, a second-year medical student. We'd like to take a moment to acknowledge what interprofessionalism means to each of us, as well as highlight some upcoming events and ways for others to get involved.
Hi, everyone. I'm Luke. I'm a first-year PA student. With my clinical experience in the emergency department, I found that interprofessional care is vital in creating a diverse team of physicians, physician associates, behavioral health, and a multitude of other professions. With this team-based approach, it allows us to enhance communication and promote shared decision-making, leading to a more comprehensive patient-centered care.
Hi, I'm Jordan. As a student physical therapist, interprofessional care means creating a space for the medical care team to work together to promote patient safety and improve patient outcomes. Patients are multidimensional, so the more that we can encourage interprofessional care, the better we can help them recover and heal.
Hi, I'm Caroline, a first-year pharmacy student, and in pharmacy, interprofessional work means making medication therapy safer, more effective, and truly patient-centered. When prescribers, nurses, and pharmacists collaborate, we prevent errors and create better outcomes and ensure the patient's understanding of treatment plans.
Hi, my name is Alexa, and as a nursing student, interprofessional care means communication. Nurses are with patients at their most vulnerable moments, and partnering with other professionals ensures that every voice is heard, especially the patients.
Hi, I'm Julia, and as a second-year medical student, I've learned that I'm just one part of a much larger healthcare team. Interprofessional collaboration means recognizing that we do our best work when we combine our different strengths, which leads to safer, smarter, and more meaningful care. Interprofessional teamwork means recognizing that no single profession can meet all a patient's needs.
Hi, I'm Rebecca, a first-year medical student. We wanted to let everyone know that we're closing out the year with a Huga night on December 8th, a time for relaxation and coming together. Come spring, we're excited to offer volunteering with Preble Street Food Security Hub on Sundays and Partners for World Health, Sim Escape Room, Interprofessional Donor Lab and Surgery Club opportunities, as well as an interprofessional pickleball tournament.
Congratulations to the teams on completing your interprofessional project. If you're interested, please reach out to ipsg@une.edu.
Thanks to IPSG, Morgan and all for putting that video together for us. It's always great to hear directly from you, and I look forward to supporting your activities in the spring. And I think Michelle is putting the list of activities in the chat so that you'll have that to refer to. This is the list of faculty mentors as represented in the projects today. Without their commitment and the generosity of their time, we wouldn't be able to offer as much as we do, as well as we do. They make all of it really possible. So thank you from all of us to you, faculty mentors, for participating throughout the year. as well as in this semester. So we have a nice spread of different professions, folks from different universities, and everyone very committed to making sure that the remarks that we just heard in the video come to life for as many students as possible. So thank you for that. And now I'm here to just preview the navigation that you're about to undertake as participants in the showcase today. So the brochure is in the chat, and I encourage you to download it. The first page shows you the navigation, and the second page shows you the details, a little bit more of the details of the presentations that you'll be seeing, and you are free to move about. So there will be a minute of time between every presentation and Q&A, so that you'll have time to move about. So if there's one that you want to see in the first breakout room and one you want to see in the fourth, you are totally free to move around. So there are 4 breakout rooms. The first one is leadership. The second one is collaboration. The third is whole person care, and the fourth is social drivers of health. And they'll be labeled as such when the breakout rooms are open, so you'll be able to navigate to them. And we have such a great range of presentations today for you. Everything from the traditional interprofessional team immersion sessions that we're accustomed to offering here. Obviously, FIT has a good representation here as well, with some new things. We have a presentation from IGEP, which we're excited to offer you today, the Interdisciplinary Geriatric Education Program, which is in whole person care in the 1229 slot. And we also have the interprofessional Michael simulation is represented twice. So 2 different teams of students who participated in the interprofessional simulation in the Sim Center in person, not virtual like IPTE and FIT are, and giving them a chance to collaborate with a standardized patient to have a clinical experience that way. And so we're looking forward to sharing these all with you. And Lee will be here in the main room. So if you get turned around or lost as you're navigating through, you can always come back to the main room and he can help navigate you. So Lee, I think if you want to go ahead and open the breakout rooms, take your brochure with you folks and go ahead and navigate to the room of your choice.
That is going to be shared is the topic on understanding roles and perspectives for compassionate care and interprofessional approach. And let's see, I know Benny McRae, you're one of the presenters, correct? Excellent. Hi. Let's see.
And Tatiana as well, ma'am.
Excellent. Hi, Tatiana. Maybe she's not quite here yet, but
Hi, sorry.
oh, there you are. Hello.
Hi.
Good to see you.
Understanding Roles and Perspectives for Compassionate Care, an Interprofessional Approach, presented by Courtney, Tatiana, and Benny, all of which are students at the University of New England. First, a special thank you to our teammates. Our team was made up of many different disciplines from UNE and Rosalind Franklin, including physical therapy, dental hygiene, public health, dental, allopathic, and osteopathic medicine. Also, thank you to our peer facilitators, Sarah and Jennifer.
Have you ever collaborated with an interprofessional team and found yourself uncertain about teammates' specific roles and expertise?
Our approach really focused on the importance of team collaboration and understanding to truly provide patient-centered care. We prioritized open and transparent communication, giving clear representations of each of our scopes of practice and sharing our unique perspectives, while giving active listening skills and mutual respect to each other in order to foster shared collaboration.
Using our initial approach, we were able to focus on obtaining subjective medical history and information from Alex as a team, utilizing our discipline's roles and scope of practice. We first understood each discipline's scope of practice and organized and assigned roles in patient interaction. We then developed and asked patient-centered questions to address diverse medical needs, actively listened and documented Alex's subjective report, and provided empathy, reassurance, and support to Alex by recommending further follow-up care.
The initial view of Alex's case was more of a clinical perspective, so we looked at his community, presenting signs and symptoms, his use of substance abuse, and mental health.
Going into our second care session with Alex, we adjusted our plan of care to really focus on how to best support Alex and regain his safety and normalness in his life. We first assessed his readiness for change and gained his consent in order to refer him to social work, help get a Maine care and ID set up, assist him in a stable housing and work program, support and guide him with drinking and smoking cessation, and facilitate referrals to support groups and community resources.
By using an adjusted review of Alex's case, we were able to identify his family history of addiction, his source of receiving substances, understanding his reasoning for not receiving prior care, and identified his housing placements based on his and his friend Bobby's perspective.
In conclusion, the EV's team approach centered on collaboration and mutual understanding to provide patient-centered care. We achieved unified, coordinated, and compassionate approaches to patient care.
Thank you so much for listening.
Great, thank you so much. Tatiana and Benny, we're actually opening up the floor for questions and answers. So if anybody had any questions for Tatiana or Benny, they are here in the breakout room. But yeah. So I did have just a quick question. I'm just curious, how did the experience go for you guys? Or how were you able to coordinate who's going to do what during that experience?
The experience was pretty amazing because we were able to collaborate with different scopes of practice and then understanding which role each person had kind of through the clinical perspective of session one helped. But then once we got to understand our patient, we formed a together as a team. So when we came to session two, we were able to understand the needs of Alex.
Great. Yeah, it seems like you guys had really great communication. Was there anything that surprised you that you learned about the other profession?
I think we had a greater appreciation for all of the professions, including professions that weren't included in our group, mainly social work being the main one. And we were really appreciative of everyone by the end. I think we went into the collaboration process, learning about each other's profession. And then as we went into our second session, I think we opened up more into an emotional perspective, which I thought was really neat. And I wouldn't have thought to gain that from a collaboration opportunity with different professions. So I really liked that. We all worked really well together.
Yeah, that's great to hear. Yeah, the emotional piece. Did anybody actually tear up during the experience?
No, I didn't. I felt uncomfortable during certain parts because I couldn't really relate to the patient with certain things. But once I was slow to speak and just wanted to listen to their story, then I was able to better understand what they needed from us.
And to add on to Benny's point, I think communicating and allowing us to talk with the actor afterwards kind of put it in perspective how they were able to put themselves into that role, especially because their lives are so different from what the patient's history looks like. So I appreciated them, and they took their time to explain how they got themselves into that process and what that looked like for them.
Yeah, that's interesting, taking on the actor role in that situation, huh? Yeah. Great. Well, anybody else who's listening in, any questions?
I don't have a question, but I was one of their facilitators for this group, and it was really cool. This was the first time I've been a facilitator, and it was really cool to see all of you guys work together, and you really didn't need much guidance, which isn't a bad thing or a good thing. It just happened to be that way, but you guys did a really good job of identifying Alex and helping him out the best you could.
That's great. That's great. Yeah, and just as a heads up, the next presentation will start promptly at 12:20. So, it being 12:19 right now, you can either stay in the leadership track and listen to the next presentation, or you can navigate to the other breakout rooms and see if there are other presentations that you're interested in. But yeah, thank you, Tatiana and Benny. Really appreciate it. It was a great presentation.
Hi, everyone.
Abby, can I ask a quick question?
Yeah.
Sorry, just before we get started. Is this being recorded?
This one will be recorded. Yes,
Okay.
the sessions and I am actually, we have the experts behind the scenes here.
My grandmother was asking. That's the only reason I.
See, Dave or Lee, can you, yep, there we go. I can confirm it's recording. Hi, everyone. I'm Abby Leiden. I'm faculty at the College of Pharmacy and in the Baldwin Institute at Rosalind Franklin University. Happy to be here. We got 10 inches of snow, so totally dumped on. I'm excited to introduce our next presentation. It's from the Seeds for Growth team, who designed a campus-wide mental health awareness and outreach event.
Hello, everyone. My name is Amelia Tata. I'm a second-year MSOT student presenting today with Rachel Parker, a third-year DPT student. Today, we are sharing our project, Seeds for Growth, students educating, empathizing, destigmatizing, and supporting for growth in mental health awareness. This was a service project event hosted last year by a group of my classmates and me to raise awareness of mental health difficulties among healthcare professionals. When we started to plan the event, we knew that it would reach more people and be more successful if we made it interprofessional. We invited 10 programs and 6 of them set up tables and activities at the event. We collaborated closely with PT to make the event accessible and welcoming to all. Let's break down the collaboration a little bit. While preparing the event, my classmates and I completed a needs assessment and identified the benefit of creating an interprofessional event.
And we wanted to create an open environment for inclusivity and accessibility. The tables were set up so that the foot traffic was inside and patrons would be able to utilize activities at each table with plenty of space. We collaborated to decide on activities to promote leisure and physical activities that are prioritizing self-care to reduce burnout. Research has found that consistency and a routine for self-care reduces feelings of stress and anxiety. So we wanted to implement a home exercise program that can still be high intense and be easily performed across various populations and requires no equipment. For interprofessional work, while we are both in therapy roles, I feel like we both have come to an understanding of how much we are able to overlap, as well as the differences that encapsulate our perspectives through the OT-PT lens. As Amelia was able to deduce specific leisure occupations that could focus on the self-care needs, I was able to also bring in evidence-based research to promote neuroplasticity and activity recommendations that both coincide to reduce burnout, stress, anxiety for healthcare workers. For the PT perspective, stress and anxiety from research causes uncomfortable emotions and physical sensations that are effective responses similar to psychological changes. These occurred during exercise. Integrating the appropriate intensity with low joint reaction force can reduce the sensitivity of these negative feelings and the effects of burnout through a consistent routine.
From an OT perspective, we put a handout on the OT table where we wanted to prioritize presenting activities and tasks that people could take with them and put into practice in their own lives. We did this through focusing on a wide variety of occupations that bring meaning and joy to a client's daily life, while making them physically and emotionally accessible to everyone. In conclusion, by creating an interdisciplinary event, we were able to focus on our strengths within our respective scopes of practice and develop a primary focus as an interprofessional team. By engaging with our presentation today, you are helping us move the needle towards a more accepting and understanding field. Thank you again for the opportunity.
Thanks so much to the Seeds for Growth team. I believe we have at least one of our members here. Do you want to give a wave, Amelia?
Hello. Yeah, Rachel has a huge test today, so I told her I'd take over.
Had some makeup exams today.
Mhm.
Well, I really thought this was such a great example of how interprofessional collaboration doesn't only happen in hospitals or clinics, but also in how we design community outreach. I'd like to invite the group here to raise your hand and ask some questions at this time. Okay, all right. Go ahead, Cameron, please.
Hey, thanks so much for sharing. I'm wondering if you were able to sort of share this with any of your intended audience and whether or not sort of it worked. So it was a wonderful sort of framing, but I'm wondering the extent to which it is actually effective.
Yeah, great question. Attendance is always difficult. I think that we spent probably 3 months reaching out to maybe closer to 6 months reaching out to all different programs, not only to be involved, but like if you don't want to do the work of setting up a table, come, like show up. I would say that for the most part, always in occupational therapy, like our biggest thing is we want people to understand what we do and why we do it. So there is definitely a huge misunderstanding of OT in general in the medical field and in the world that so much of our goal was to build something that future cohorts could do for their service projects. So like we had to start from scratch. Last year, our lovely professor, Carol Padavina did this project with a mental health clubhouse who ended up not doing it with us. So we were starting from scratch. Attendance wasn't where we wanted it. We had probably 10 to 15 people stop in, including a dental student who we hope we convinced to join the new cohort. The biggest thing I think for us was in that effort of trying to get other clubs, other disciplines to join us, and then also some undergraduate clubs, like we had applied exercise science as a major and a club, for example. Not only getting out the word of OT and interdisciplinary collaboration, but just you're allowed to have mental health difficulties as a healthcare professional. You don't have to be this crazy strong person. So with that being the goal, I think overall we definitely did what we wanted to do, and in setting something up that next year's crew can build on and make their own, but the foundation being laid, we definitely did that as well.
Great, thanks.
Thank you.
Any other questions amongst the group? Well, here's one kind of thought, and it's a little going on what you just said is maybe how did you feel like having multiple professions at the table impact the design of the event compared to maybe what it would have looked like if it was just one profession that planned it?
Yeah, so I think that was something we heavily took into consideration. I believe there were 6 of my classmates and I, and originally it was just OT puts on this mental health event. to destigmatize, and we took it in the direction this year of for other healthcare professionals, not necessarily destigmatizing for healthcare of our clients and other things like that. I would say that we really started with just OT to get us to the point of deciding to be interprofessional. We did stay pretty OT centric just to get a baseline so we would know what we needed help with in the first place. Because the second there's like all 6 different disciplines, 6 people on a team, it's way too many cooks in the kitchen to make it productive. So I would say that by at least establishing a groundwork and a common goal in general, it made it easier to include everyone down the line and give everyone more say on their section.
Excellent. Thanks so much. Well,
thank you
for sharing this with us today. And believe it or not, it's time for everyone to hop on to the next group. So congratulations to your team.
To the presentation on Elder Teacher Perspective, How Aging Impacts Care by the student team Haley and Destiny.
Hello, my name is Destiny, and my partner Haley and I are going to be discussing how the elder teacher perspective and how aging impacts care. So we interviewed an elder teacher who we'll call Mrs. P, and she lives in a retirement community with her husband, Mr. P. And this experience was to just focus and strengthen our clinical interview skills for patients within Mrs. P's population. I'm a physician assistant, as well as Haley is going to be a pharmacist. So we're both future healthcare providers. With Mrs. P, she emphasized how location really impacted her ability for her and her husband to reach care, especially because her driving ability changed or has changed over time. She really noticed this when she had her hip surgery earlier this year, because she is the primary driver for both her and Mr. P. She found that that was a barrier that she experienced and continues to experience as she matures. Additionally, she noted that by having hearing aids, if she doesn't have them accessible, that also impacts her ability to understand the world around her, including in the healthcare setting. The support system that she emphasized was both inside the retirement community as well as outside. Services such as grief counseling and activities with other residents like Domino's and book club really helps with the mental well-being of both Mr. and Mrs. P. Additionally, having access to healthy foods through their cafeteria and exercise classes for balance was really essential for them as well. I'm going to hand this over to Haley and she'll continue from here.
I'm Haley. I'm a third-year pharmacy student. I'm just going to be talking a little bit about my experience visiting our elder. So to start, I'll just talk about the medication labeling challenges that we noticed. Our elder was recommended to take Voltaren gel for arthritis by her provider, and this was something she talked about to us. She hadn't used the medication yet because she had trouble reading the instructions, so she asked us to further explain it to her. As you can see, the package instructions are very small, and because of the size, you can miss some of the important cautionary information, and not being able to read them at all might cause you to take it incorrectly or skip your dose altogether because you can't read the instructions. This medication is different from other medications because it's a gel. So as you can see in the corner, it shows you how to measure out the gel, which is not as simple as just taking a pill. This was something that we noticed was important as providers, just to make sure that we're taking the time to explain to our patients how to take an over-the-counter med and recognizing that there's not always someone at home to explain. Another barrier to care that we noticed was cost. So her and her husband were recommended to take these eye vitamins. The dose is 2 pills per day, but because of cost, one bottle is up to $30. They couldn't afford that, so they kind of alternated between 1 and 2 pills. So financial limitations are another thing that can affect adherence in aging populations who take multiple medications. So as providers, just looking for ways to lower the cost or help with that is important. And that concludes the end of our presentation. Thank you for listening.
Is Haley or Destiny here?
Hi, everyone. Haley is not able to join us today, but I'm more than happy to answer any questions that you may have.
Okay, thank you. It was a great presentation. Does anyone in the audience have any questions for Destiny? Well, I have a question, well, more like a comment. I noticed that in one of the slides, it stated that the providers need to explain the medications. And oftentimes I think providers just say, oh, go talk to a pharmacist, right? Because they're the drug expert. So why did your team decide to put providers and not necessarily the pharmacist?
I think that it's important as providers to constantly expand our healthcare acumen. So, in my training as a physician assistant student, we're being told and basically expected to know specific side effects of certain medications, and it can help provide basically more holistic care for patients. We decided to put both myself as well as Haley in this specific scenario because it gives the patient basically more opportunities to hear the information, meaning that they'll be more likely to understand and retain it in the long term.
It's a good way to reinforce from what one provider says to the next provider.
Exactly. But definitely utilizing our pharmacy colleagues is essential, especially when it comes to all the different mechanisms. They are truly the experts.
And the over-the-counter medications, there's just too many to remember, to be honest.
Absolutely. We just do our best.
So was there one thing that you felt you learned from your elder patient that you wouldn't have necessarily learned if the patient was younger?
I do. I find that with the elder teacher experience that we had, she really appreciated us just actively listening. I remember we had multiple visits with our elder teacher, and I remembered, I believe it was her son's name, and she felt very heard and very impressed with that encounter because it showed just overall care for her as a person. And I think that if the patient was younger, they may have not picked up on that, or they may have not felt that that was like as strong of an indicator for not only our active listening skills, but like our ability to understand her and ensure that she felt heard, essentially.
I know that you listed the support system, and one of them was resources. How difficult did you find that the resources availability for the elder patients?
For our specific elder patients or elder teachers, they are very fortunate in the fact that they live in a retirement community that has access to a lot of resources. So, all the resources listed were actually community events put on by other members within that community, such as the grief counseling, exercise classes. She actually is also, I call it a welcome wagon. So, she helps to connect other people who are new residents on her floor to those resources. So, for this specific instance, the access to resources wasn't as much of a problem as it would be had that person been in a different setting.
Harrigan, did you have a question?
Yeah, do you and anyone who I guess works more with patients can answer this too. Do you think that there is a sort of barrier in wanting to ask for help with your medication and the prescriptions that are given to you? And if there is a barrier in asking, do you think that we see that more from an older population or from a younger population?
It's a really good question. To address your first question, we did actually run into this with our elder teacher. She did ask us for help with the Voltaren gel, but it wasn't because of a lack of wanting to understand or know how to apply it. It was more of a she had other questions that were addressed during that visit. And I think that that can happen specifically with more patients with more chronic conditions or multiple conditions, because the waters can get really muddied and it can be very difficult, especially when you have such a short time slot to address all the patient's concerns, to make sure that all of those questions are answered. I do think that it can happen in younger patients, but I think that because as we mature, we tend to have more chronic health conditions, it tends to present in patients in more of a elder population.
Thank you so much, Destiny, for your great presentation.
Thank you.
If anyone wants to go to another breakout room, please do so now.
All right, so this is in the live stream. So in the next one, this is interprofessional collaboration in sickle cell anemia.
Hi, everyone. We're FIT Team 1 at UNE. FIT is a program on adapting public health problem-solving paradigms and interprofessional team training. The main goal of this was to look over a case, and overall the case highlights how an interprofessional model supports more holistic, patient-centered care and shows the impact that effective collaboration can have when managing challenging health situations. Our case is a 37-year-old Spanish-speaking woman from the Dominican Republic who lives in a shelter with her 3 children. She was diagnosed with sickle cell anemia with recurrent vaso-occlusive crises and is currently using the ER as her main source of care. Her history also includes alcohol use disorder, functional asplenia, and worsening renal function.
And here's the framework we developed and worked off of to capture all aspects of our patient. In terms of interprofessional collaboration, we considered a holistic understanding, mutual learning among team members, a use of shared language within the team so that we could collaborate effectively. We also took an equity and justice focus that we felt was really important. And finally, we determined if our goals were feasible and aligned.
For our collaboration began by jointly identifying the most pressing issue, her health, in the context of unstable housing and limited access to care. Each member analyzed the case through their disciplinary lens and shared insight to construct a cohesive framework and interventions. Leah and Maddie identified clinical needs, I assessed feasibility with food insecurity, and Stel layered this with a broader social and policy structures. Regular discussion ensured that each domain informed and reinforced the others.
For our group dynamics, we found it challenging to cover both medical detail, nutrition, and public health policy without oversimplifying any of these aspects. We worked together to build bridge together clinical terminology and public health concepts in our final framework and proposed interventions. And we address these efforts by engaging in open discussion and having a shared goal of centering the patient's actual lived experience. We believe that this resulted in a more holistic framework as well as a better understanding of each other's disciplines.
Our interprofessional approach allowed us to produce a framework that not only addressed the patient's immediate medical needs, but also proposed sustainable and justice-oriented interventions. This collaboration demonstrated how diverse disciplines, when united with a focus on social justice and patient-centered care, can transform isolated intervention into a comprehensive and equitable care plan. And this is our works cited.
All right, great. Anyone have any questions for team? And if team one want to raise your hand. All right. So your presentation was the framework, it showed up pretty quickly. I don't know if everybody catches, if you guys want to talk a little bit more about, elaborate on, what you guys thought about your patient needs.
Well, our patient did have many diverse needs. As mentioned in the title and on the presentation, she is a sickle cell anemia patient who's often hospitalized. She is currently living in a shelter, and she does not have a great proficiency in the English language, which makes all of her interactions extra difficult. So that's something that we try to be conscious of along all of our interventions and the framework that we designed for the patient.
Yeah, like you guys had, beyond the health, there's education, there's social justice and ethics and all those factors. And I guess I would use the same question that Chris asked the last team. What other professions you wish in your team?
I know from my perspective, I'm a DO student. I think it would have been really interesting to have a PA student on, just because I haven't had a ton of exposure to work with PA students, and just to see what they could bring to the table would have been really interesting.
I think I would have liked to have pharmacy. We didn't have pharmacy, and she was kind of medically complex and navigating her access to medication and what medications would be recommended and what other resources she may have for affording those medications would have been great to be able to really consider that.
There's a question in the chat if you guys want to respond. Can you guys see it?
So in our original case, we didn't have her initially set up with a caseworker, but one of our resources that we were talking about was setting her and her family up with just a case management like organization, so then they could work through that. And we also broke our interventions up in a couple different levels, so we could address like individually, like things that were impacting her, things that were impacting her family, her community, and then just globally or like throughout the country at like a public health scale.
Other questions from the teams, from everyone? So if you just joined us, this is for a social driver of health. Oh, guess we're ready for the next one. But feel free to continue putting more questions in the chat. All right, so this is the last talk in our session, interprofessional collaboration for quality patient care.
We have just a few seconds. I'm going to give a shout out to the Interprofessional Simulation and Innovation Center, Ashley Buckingham as the director, as they worked together with faculty to develop these interprofessional cases, and there'll be more of them available in the spring. And so if you want to do an in-person interaction, that would be watch for that and sign up for that. You can learn about that in our weekly email.
That would be really great.
Hello, and welcome to an interprofessional collaboration for quality patient care. I'm CJ Greenway with an expected BSN in 2027 with several years of direct patient care experience.
And I'm Gina Kalari. I'm an expected DMD candidate in 2029 with a background in nonprofit social work.
Within this simulation, we had 3 students from different healthcare professions who collaborated together to deliver a quality care plan to our patient, Michael. It's worth noting that our third healthcare professional student is in pharmacy, but is not joining us for the showcase. Michael's a 74-year-old veteran who recently fell and cut his head. He lives alone in small rural Maine and has a very small support system. He gets his financial benefits from the VA and by doing odd jobs around his town.
We had 3 meetings with Michael, our patient, and in between each of those meetings, we met as an interprofessional team to debrief and create a treatment plan. So this is kind of an outline of our meetings. You can see we had 2 information gathering meetings with Michael with debrief sessions in between, and then the final treatment recommendation meeting.
In those meetings, all 3 of us went in with Michael, all 3 health professions. He was a little bit more reserved, arms back to the wall, hesitant to answer the questions, but we learned he had type 2 diabetes that was poorly managed and has a significant fear of falling again. We learned how he was getting to his medical appointments, getting his prescriptions, and discussed his goals moving forward.
During our debrief sessions, we really got to flex our interprofessional knowledge. Our third team member, our pharmacy student, provided a lot of information around drug interactions and things that he had more expertise in, which was extremely helpful. CJ was able to provide expertise in diabetes management and home care with her nursing background, and I provided a lot of overall organization and other suggestions for home care management as well.
Our recommendations included providing him with a home health aide, purchasing Life Alert, and recommending different dietary recommendations.
We learned a lot from this simulation. When we gave our treatment plan to Michael and the simulation was finished, the actor who played Michael came in to meet with us and give us feedback. And he said that he felt that we had really clearly defined roles and excellent collaboration, which we really felt in the moment, I think. And he also gave us some really constructive feedback around overall exuberance and some medical jargon that we'll take with us in our future careers.
Thank you so much for watching, and we're looking forward to your questions.
All right, really lovely presentation. Anyone has questions? So can the team member raise your hand? All right. I have a really quick question. I think your program is really, really nice. You can have a direct feedback from your patient actor, and that's our virtual program cannot do. So how did you feel, when you have a conversation with the patient? Did he like the plan? And, what did you learn additionally during that feedback time?
I'm happy to speak to some of the feedback. Sorry if there's a lot of background noise. So it was really interesting to receive feedback right after from the actor. It was at first a little alarming because when he started speaking to us as not Michael, we were like, wow, okay, you're not him actually. And he gave me some really good feedback that I'm going to take with me into my future career. I tend to be somebody that's a very exuberant person, and I'm like, oh, I'll lead with friendliness, and that wasn't necessarily well received initially by Michael. He was maybe tone down the exuberance a little bit if you see that this person is somebody that is kind of reserved, and he was sitting with his back against the wall, which I really appreciated that feedback because that was a definite growth area for me. And then he said in general that we did a really good job collaborating as a team, and he felt that it was clear in our roles and that we were very organized in what we were saying. So yeah, I don't know if CJ, if you want to add anything.
No, that about covered it. The only notable thing too is he also, like we said in the video, addressed that we use some medical jargon that he was not familiar with. And so again, like using that moving forward when we're talking to patients, especially from rural areas that might not have the same access to healthcare, or that health literacy too. So, but it was very interesting that we were able to get that feedback right away, and just take that with us too moving forward.
Yeah, I was actually gonna, I'm curious because you mentioned that Michael was a pretty reserved at the beginning. How did you guys open him up? Like what approach you used?
Honestly, I would say shout out to our pharmacy student who is not in the showcase. He is also from like northern rural Maine, and so he was able to connect with him about that. And he was also very personable, but matched him on that level that Michael needed, and kind of opened that gateway up, to Michael opening up to us, which then kind of led the way for us. But I would say major shout out to Evan, our pharmacy student, who's not joining us for the showcase today.
That's really great because we always,
Yeah, I
tell you
agree.
guys.
And
Oops.
oh, sorry. I
Go
think
ahead. Go
my
ahead.
internet's a little slow, but I agree. And I feel like the feedback that he gave about us coming off as a little exuberant in the beginning was good feedback. But then I also felt like that helped us. Like he warmed up to us and then ended up like really liking us. So it was kind of like this both and of like, yeah, maybe like we can be more conscientious of like how we start the conversation with somebody, but then like continuing to be yourself and being like friendly and listening and exuberant in that way like does go a long way in building connection. So yeah, it was good.
Yeah, that's really great because we always are saying that a patient is on that we're on the team, right? So we want to include them. We don't want them be, close out and then not telling us what they're thinking. And it's actually your program to demonstrate that. And also they can be in your team for training as well. It was really great. Anyone else have questions? So I think this is the last talk in our session. And don't forget to log your attendance. The link is in the chat and it will be on the last slides in our presentation as well. But in the meantime, let's keep the conversation going. What did you guys all learn from your experience? We can talk about anything about interprofessional practice and education. It does not have to be related to this particular presentation.
I really like the Michael experience. I did it too. I think it's really, really helpful just to be in that lab at UNE. It's such a nice, lab in innovation. Just being there as much as possible just helps a lot. So.
Mm-hmm. Yeah, Jennifer?
I have a question for you guys. So, with having, more limited people on your team, did you ever have any times that came up where you found that he was asking about questions or topics that you couldn't answer because it wasn't necessarily in your wheelhouse? And how did you manage to go through that?
That's a really great question. I felt like even though we were a small team, we were coming from such different specialties and we really relied heavily on our pharmacy students. And then CJ just has a wealth of experience in the nursing field as well that she brought to the table. And I have less experience in terms of being a first year dental student, but I had 4 years of prior work experience in like a social work field. So I really relied on that, which I feel like kind of helped add maybe an extra profession like in there. But yeah, CJ, if you want to add anything.
Yeah, that kind of is the gist of it too. And also in between each session, we had like 15, 20 minutes to talk about everything. And we had a big whiteboard and we identified any places that we were missing any knowledge. And really there wasn't a whole lot. I mean, the only thing we were truly missing was a physician. But like Gina was saying, with the pharmacy, nursing, and dental medicine and all of our backgrounds previously, together, we really did make a good team and try to fill all those gaps in his social determinants of health.
Anyone else used this same case? If you want to chime in, how your team do?
Actually, Ling, we're gonna have to let people go.
All right. So make sure you scan the QR code or going to that link, log your attendance for the event. And thank you all for coming and a good conversation.
Yes, thank you, everyone, and we'll see you in the spring semester.
Thank you, guys.